Imagine you are sitting in your home, nicely chatting with your girlfriend, then your father calls, okay? Your father calls and hand a ECG paper to you, means he will give a reports to you of his friend, okay? And tell what are the outcomes of the report. And in that, most commonly you will get ECG paper, and you don't even know how to read a ECG. This video is based on like how to read ECG, okay? So before going into the topic, please see ECG basics video of mine, because I have explained what is ECG, how it is taken, and overall basic things you need to understand before learning how to read the ECG, okay? So in ECG there are 10 points, okay? These 10 points if you have done, you will come to know like how to read ECG very easily, okay? So we will cover all the 10 points, but in this video I will tell mostly 3 points along with quick revision of the ECG basics, okay? Let's start the video. So we are going to learn about how to read ECG or EKG. ECG is also known as EKG, okay? So you can see this is my YouTube and Telegram handle, that is Medico India, and my Insta and Telegram ID are at @ejija12355. You can approach me at any time and anywhere. You can ask anything, okay? Chalo, let's start. So starting with the basics, what is electrocardiography? Electrocardiography is a technique by which the electrical activities of the heart are studied. Graph is the instrument. Gram is the graphical representation on the paper, okay? What are the uses of ECG? We can determine heart rate, heart rhythm, abnormal electrical conditions, ischemia, heart attack, coronary artery disease, hypertrophy of the heart chambers, okay? For determining the ECG, we will use ECG leads, okay? More than what are leads? When we use more than 2 electrodes, then will become ECG leads. ECG leads are totally there are 12 leads: unipolar and bipolar. Bipolar is standard limb leads, okay? Unipolar leads are unipolar limb leads and unipolar chest leads. So there are total 12 leads. 3 limb leads are L1, L2 and L3, that is 1, 2, 3, and 3 augmented limb leads are AVR, AVL and AVF. Next is 6 chest leads, that is V1, V2, V3, V4, V5 and V6. Three limb leads and augmented leads determine the electrical activity of the heart in the vertical plane, and 6 chest leads determine the electrical activity of the heart in the horizontal plane. Okay, here the ECG approach starts, okay? The speed of ECG paper is 25 mm per second. 25 mm per second. It indicates the speed of paper. The paper moves 25 mm in 1 second, okay? Therefore, let me show you. Now here you can see ECG paper is divided into these kind of boxes, okay? This is one big box, and in one big box there are 5 small boxes arranged into 5 into 5. Length and height is 5 into 5, okay? You can see the one big square. This is one big square, okay? This is one big square and this is a small square. One big square consists of 5 small squares arranged in length and height, okay? The overall length of one big square is 5 mm, okay? It is 5 into 5, and on the x-axis we have taken time, and on y-axis there is voltage. The length of 5 mm constitutes 0.2 seconds, and this side 5 mm constitutes 0.5 millivolt, and the length of one small square and length of one small square is 1 into 1 mm into 1 mm, okay? Here 1 mm indicates 0.1 millivolt and the time is 0.04 second. When 0.2 is divided by this 5, there are 5 boxes, no, 5 small boxes. One big box contains 5 small boxes in lengthwise. When 0.2 is divided by 5, we will get 0.4, okay? You can understand by this. Therefore, 25 mm per second indicates 25 small squares are moving in 1 second. 25 small square means 5 small square constitute one big square, no? That's why 5 big square passes in 1 second. I hope you understood. The one you are seeing downside is known as standardization of the ECG, okay? I will show. See, here you can see the length, the height of this is 1 centimeter, that is 10 mm. It indicates of 1 millivolt here, 1 millivolt, okay? It should, if it is not 1 millivolt, that the ECG will be wrong. One large box crosses in 0.2 second. Thus 5 large boxes pass in 1 second, okay? And one small box crosses in 0.04 seconds. It is like some basic maths you should understand. Okay, this is the graphical representation of the ECG. Every time they may give only upside strip, only A part, but some places they may even give B part, okay? The B part is nothing but lead 2. Well, let me show the arrangement. See, every time the graph will be in the same pattern. Here is the lead 1, here will be one graph, here will be one graph, this type, okay? Here is the lead 1, lead 2, lead 3, AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. The one which given fully downside will be the lead 2. Okay, the lead 2 is also known as rhythm strip. Understand? Every time the ECG paper will be in lead 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. The downside strip will be rhythm strip. This is the same. Okay, you can let me one more picture is there. See, here is the lead 1, here is the lead 2, here is the lead 3, AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. This is the lead 2 strip, also known as rhythm strip. Okay, the one which was given extra downside will be lead 2. Lead 2 is nothing but this strip only, the one which you are seeing. This is the strip they have given extra downside. Okay, now starting with how to approach a ECG paper. Okay, when you are holding a ECG paper, what all things you should check out. Here are the 10 basic things you need to check. First is rhythm, next is rate, third is cardiac axis, fourth is P wave, fifth is PR interval, sixth is Q wave, QRS complex, ST segment, T wave and QT intervals. Okay, to know before starting the approach, you should know the basics of the ECG. Okay, there is one more video of ECG called ECG basics of mine only. Please watch that video and then come to this video, because without understanding the basic things of ECG, what all the segments like P wave, QRS complex, what are this time taken, what is the voltage of such waves, how many segments, how many intervals, and how the ECG will be determined, what are the position of the leads, what are the types of leads, everything is explained in the ECG basics. Okay, here is we will approach ECG. In this we will learn only first three things. These are the most important things. Okay, rate, rhythm and the cardiac axis. Rhythm is also known as sinus rhythm. Rhythm is presence of sinus rhythm. What is sinus rhythm? Sinus rhythm is nothing but P wave should be followed by QRS complex. You know normal ECG. See, here is the P wave. This is a P wave. P wave should be followed by this QRS complex, and this is a T wave. Okay, P wave should be followed by QRS complex. This is sinus rhythm. And rhythm is divided into two types: regular rhythm and irregular rhythm. Irregular rhythm is further divided into two types, that is regularly irregular rhythm and irregularly irregular rhythm. Now first we will finish what is regular rhythm. Okay, regular rhythm, when ECG is said to be regular rhythm, when it has equal RR interval and P wave is always followed by QRS complex, that is sinus rhythm. Let me show you. This is the ECG of a regular rhythm. Now, you can check. First we will check distance of RR interval. Okay, check from here, this until from this to next R wave. How many boxes are there? How many big boxes and how many small boxes? It is easy to count how many big boxes are there. Count like 5, 10, 15, 16, 17. Totally 17 boxes are there from here to here. Okay, from here to here 17 boxes are there. Now count from here. 5, 15. One box, here one box. Totally here also 17. Total are 17 boxes. 17 small boxes or 3.2 of big boxes. Okay, this is the regular RR rhythm. And every time you can see, every time the P wave is followed by QRS complex. P wave followed by QRS complex. P wave followed by QRS. Whole graph P wave is followed by QRS complex and has RR interval, equal RR interval. This is regular rhythm. Now coming to the irregular rhythm. Irregular rhythm is divided into regularly irregular and irregularly irregular. First, regularly irregular. It is said when one wave misses regularly, that is known as missed drop or drop beat. Missed beat or drop beat. Okay, it is seen in second degree heart block. Here is a graph of a regularly irregular rhythm. Let me show you where it has come. See, here is a P wave and here is a QRS complex. Same here also P wave, here is a QRS complex, but this is a T wave. Okay, and P wave there is no QRS complex like this, and next P wave is there. What does indicate? Here it is missed. Okay, you can see this is type 2 heart block, P wave, QRS complex, T wave. Next is a P wave, but there is no QRS complex. Again P wave, QRS complex, T wave. P wave, no QRS complex. Okay, you can see there is no QRS complex, and next P wave starts. Here at regularly there is missing up of a QRS complex. You can see there is missing up of QRS complex. This shows this is a regularly irregular rhythm. Now coming to the irregularly irregular rhythm, it is seen in there is unequal RR interval, and P wave is not followed by QRS complex. There is unequal RR interval and there is no sinus rhythm. It is seen in atrial fibrillation and atrial flutter. Okay, it is seen in atrial fibrillation and multifocal atrial tachycardia. Let me show you that. Atrial flutter or variable conduction, it is seen in irregular rhythm. And one more important thing, which type of which ECG we will see. This is lead 1, lead 2, lead 3, AVR, AVL, AVF, 1 2 3 4 5 6 chest leads, V1, V2, V3, V4, V5, V6. The one which you are seeing is here is lead 2. Okay, the downside one here, this one you have to see. Okay, let me zoom for it. Okay, I hope you are seeing it. Now check the RR interval of every QRS complex. Here is the RR interval. There is unequal RR interval. You can check the RR interval here and the RR interval here is different. Okay, there is unequal RR interval and there is no proper P wave followed by QRS complex. See, you can check there is no proper P wave followed by QRS complex. Okay, I hope you are understanding. See the lines. Okay, there is no proper P wave after P wave is not followed by QRS complex and there is unequal RR interval. Rhythm is divided into regular rhythm and irregular rhythm. In irregular rhythm, regularly irregular and irregularly irregular. Okay, this is regular rhythm, regularly irregular and irregularly irregular rhythm. Now coming to the rate. Okay, what rate is nothing but heart rate only. First, heart rate in regular rhythm, it is determined by there is one formula, that is heart rate is equal to 300 divided by number of big square between two R waves, or 1500 divided by number of small square between the two R waves. We should take 300 if we take big squares. Okay, you should take 1500 if we take small squares. And if the heart rate comes out to be greater than 100 beats per minute, it is tachycardia, and less than 60 beats per minute, it is bradycardia. Okay, let me show you like how rate will be determined. See the distance from two R peaks. Okay, this one and this one. We know there are 17 small squares. So how heart rate will be calculated? Heart rate is equal to 1500 divided by 17, because as I am taking small squares, that way I will take 1500. Okay, so answer will become somewhere around 88. Okay, 88 beats per second. In this way heart rate can be determined. Or if we take small squares, if we take big square, it will become 300 divided by number of big square, that is nearly 3.2. 3 big square along with 2 small squares, 3.2 something. Okay, and so this is the way you should calculate rate in regular rhythm. Now in irregular rhythm, okay, we already saw like irregular, there are two types, that is regularly irregular and irregularly irregular. How it is calculated? It is calculated number of R waves in 6 seconds into 10. Okay, the number of R we should take totally 6 seconds ECG of 6 seconds of lead 2. Okay, and we should multiply how many R waves are there into 10. So we know ECG paper passes in 25 mm per second, which shows there are 25 small squares are passes in 1 second. 25 small square constitute 5 big squares. Okay, 5 big squares are passes in 1 second. So in total 6 seconds, how many squares will pass? 30 big squares will pass. Okay, so count the number of R waves in 30 big squares. So here are the 30 large squares. We will count the total number of R waves. 1 2 3 4 5 6 7 8 9 10. Nearly 10 are there. 10 into 10, we should multiply it by 10. Okay, we will get heart rate in a irregular rhythm. I hope you understand. The 25 mm per second is the speed of the ECG paper, which indicates 25 small squares are passes in 1 second. So 5 big squares are passes in 1 second. So totally in 6 seconds, how many big square will pass? 30. Okay, I hope you are understanding this math. This is rate. Now coming to the cardiac axis calculation. For cardiac axis calculation, we will see lead 1 and AVF. Okay, lead 1 and AVF. For in that we will do R minus S. Okay, let me show you. So for cardiac axis, you are seeing lead 1. Okay, that is here, and you are seeing AVF. Okay, these two segments, 1 2 for cardiac axis. Okay, in that we are going to do R minus S, where R is the height of the R wave and S is the depth. Okay, R you know, this is Q, this is R, and here S. And this is the isoelectric baseline. From that R height of R wave and depth of S wave. Okay, the isoelectric baseline, height of R wave and the depth of S wave, we will do R minus S. Okay, we should do this R minus S for both. Okay, both of that lead 1, this lead 1 and AVF, and for that R minus F we have to put a graph. Okay, here you can see for axis calculation we will take lead 1 and AVF, and we will put a we will do R minus S of both lead 1 and AVF. If both the values of R minus S came to be positive, then it will become normal axis. If both become negative, it will become extreme axis deviation, which indicates ventricular tachycardia. If it become R minus S value of both lead 1 and AVF, lead 1 become negative and AVF become positive, then it will be right axis deviation, which indicates right side heart is enlarged. And if lead 1 is positive and AVF is negative, which it indicates left axis deviation, that is left side heart is enlarged. I take a screenshot of it so that you can remember this chart for cardiac axis. So understanding more deeply, where R is the height of the R wave and S is the depth. Okay, so normal angle is minus 30 to 110. So here is one diagram, let me show. See, here you can see this is a lead 1 and here is the AVF. This is take this as x-axis and this is y-axis. This is negative x-axis and this is negative y-axis. On x-axis there is lead 1 and on y-axis we have AVF. This is minus of AVF, this is minus of lead 1, this is plus, this is plus. So you should know why the lead 1 has come in x-axis and AVF has come on the y-axis. Okay, in ECG basics I have already showed this picture. Okay, you can see the lead 1 is at plus 0 degree and AVF is present at y-axis, that is plus 90 degree. So this they have taken this as minus of lead 1 and this as minus of AVF. Okay, the graph become like this. This will be plus plus, this is minus minus. I hope you are understanding. The points which come under this which both are positive, it will come under normal axis. Okay, in the points in which the lead 1 is positive and the AVF is negative shows left axis deviation, and if both are negative they shows extreme axis deviation, and the one in which the lead 1 is negative but the AVF is positive, that will show right axis deviation. See, here you can see this is the x-axis which is positive, and here y-axis which is positive, and this is the AVF negative, and this is a lead 1 negative. The graphs which are coming here will be both will be positive and shows normal axis deviation. The graph which are coming here both will be negative and shows the extreme axis deviation. The graph which lying here they will show left axis deviation, and the graph which are lying here shows the right axis deviation. Okay, simple method of determining the cardiac axis. Now how to point out those points? Okay, here let take this as R minus S values. Okay, the R minus S values of lead 1, the R minus S values of lead 1 as 0.1, 0.2, 0.3, 0.4 until 1.3. The R minus S values of AVF. Okay, AVF, the mark them and point the value. Here some point will come. Okay, here both will be positive, and at this point draw a imaginary line from the 0 and like this. Okay, the angle which is made here to with that of x-axis in degrees. Okay, this is the normal angle that comes to be minus 30 to plus 110 degrees. Okay, I hope you remember like your second year physics. Okay, it is same like if the line went this side, it shows left axis deviation. If the line went this side, it shows the right axis deviation. The normal angle for normal axis is minus 30 to plus 110 degrees. Okay, with this I have finished rate, rhythm and the cardiac axis. The further 7 points will be completed in ECG part 2. Okay, please watch part 2 also, and please watch basics also. All three, if you watch all 3 videos, you will ace in finding the ECG. Thank you everyone, please, for watching the video. These are some few points you must keep in the point. Okay, it took a lot of effort to make these videos. Please do like, share and subscribe. Everything you should do. Okay, please show support. Thank you. Bye bye. Jai Hind, Jai Bharat.